Hello. Welcome to this special edition of The Vibe Life. The Vibe that stands for Women Inspire, Build and Enhance is a platform dedicated to fostering women's excellence. It brings together women doctors from diverse specialties to share knowledge, leadership experiences, and personal journeys that inspire growth and collaboration. There are four fundamental pillars of the vibe that are as physical well being, mental health, financial wisdom, and professional excellence. Through various initiatives, the vibe strives to build a strong community of women professionals who uplift one another and redefine the landscape of healthcare leadership. I'm Dr. Ritu Johari, consultant diabetologist and metabolic expert practicing in western suburbs of Mumbai. I'm privileged to have a unique diverse background with a decade and a half spent in pharma industry, working behind scenes of drug development, marketing and support, but now into clinical practice for last half a decade, treating diabetes, thyroid and obesity. Besides directing our two clinics, I also enjoy applying my past learnings in the pharmaceutical era as a co-founder of a medical marketing agency, RFET. But what brings me utmost pleasure in sharing is the introduction of this unique initiative, this dynamic platform, Vibe, as a founder of one of its kind, with other wonderful women with me that targets fostering women excellence. With that, let me introduce you to our team Vibe and a very warm welcome to our guest of today, our international guest, Dr. Niti Pall.
So, good afternoon, madam. We are really very happy to have you with us. I am Dr. Lotika Purohit, a diabetologist and a lifestyle medicine physician practicing in Kulaba, in Mumbai, since the last 3 decades. I am also visiting faculty at Grant Government Medical College and Sir JJ Group of Hospitals. And besides that, I'm the partner with Sugar Doctor, and I'm a mother to an artist and an entrepreneur. But really, the highlight of our week for the last few months has been this chat that we have on Wednesday afternoon with other women who are star achievers in their lives and who touch the lives of so many people on a day-to-day basis. Now I'll hand over to Dr. Kavita Rani for her introduction.
Hi, good afternoon, ma'am. Namaste, everyone. I'm Dr. Kavita Rane. I'm a diabetes and obesity expert practicing for the past 15 years at Chembur. I have my own clinic called Diabetes Total at Rane Hospital, Apollo Spectra, and Inlax General Charitable Hospital in Chembur. Along with diabetes and its treatment, I love educating people and doing community camps together at our hospital. I also love drawing, painting, sketching. I love EDM music. I love to play golf. And amongst all the other things, I love to be on this Vibe, Wednesday Vibe Live. Over to you, Dr. Pranjali.
Thank you so much, Kavita. Good afternoon, ma'am. I'm Dr. Pranjali Shah, Director and Chief Diabetologist at Diabetes Clinic and Director of Internal Operations at iHeal. It's a complete eye care center. It's in Mulund, Bombay. I love treating young diabetic patients and help them live longer and stronger. But I also strongly believe in prevention and awareness, and through community awareness camps, we have screened more than 30,000 people in central Mumbai. But if you don't find me in my clinic, you will see me doing farming on weekends. I was a state level player, badminton player, so you will see me on the court, hiking with my kids. And the most important part is being a co-founder in Vibe. The most interesting thing is connecting with inspiring people like you and interacting with them is the new learning, which is we enjoy a lot. Thank you so much, ma'am, and over to you, Dr. Rukia.
Hello, ma'am. Good afternoon. And so happy to have you here. I'm Dr. Rukia Surya Sheikh. I'm a diabetes, thyroid, and obesity specialist practicing in Mulund for a decade and a half. I'm also a mother of two, one in grade 10 and another one in grade 6. So life outside this clinic is very busy and joyful both. I'm married to a medical oncologist who's a director at medical oncology at Nanavati Max. So that means these medical conversations they often continue even at our dinner table. In my free time, what I enjoy is working out. I love to play carom, and these meaningful conversations, especially the most dear to our heart, are these Vibe Lives, which go on every Wednesday afternoon. They are filled with laughter. And lately, I have also started painting, my way of adding little color and calm to the chaos of daily life. So it's so wonderful to be here among such inspiring women doctors today. Thank you, ma'am, for being here with us.
Thank you, girls. And ma'am, really, it is an honor to have you at this particular forum. First of all, a very warm welcome. Looking at your entire career from this side is definitely nothing but sheer inspiration. And that's why what prompted us to put up the theme for today was empowering women in global healthcare leadership, navigating the challenges and driving a change, which you've been doing so far. So, very warm welcome and quick words from you of how did you feel when you heard from Dr. Lotika about this platform?
Well, it was great. I think I had a glass of wine in one hand, and we'd been dancing together for a little bit before that. So, yeah,
Yes.
it was a very warm introduction with Dr. Lotika in Hyderabad, and it was just so great to see so many women doctors out there. It was amazing. I firmly believe that you guys are changing the world, really. It is the women that are changing the world. So it was lovely to meet you, Lotika. And then I found some connections with some friends of yours that actually live not too far away from me in the UK.
Oh, okay. That's so nice.
Small world.
Yeah, it's a very small world. And yeah, so should we start with our intro?
So
Okay,
I have just few words to say about ma'am first.
yeah.
So some doctors, this is for the audience, guys. Some doctors build practices, and some of them build institutions, but a very rare few builds the entire healthcare system across the world, so that our patients can get much better care and move towards much better outcomes clinically. This speaker of ours firmly believes and belongs to that rare league. Dr. Niti, at Vibe, we do believe that women doctors don't just practice medicine, they actually shape the future of healthcare. And so happy to see that your thoughts resonate with ours as well. Thank you for showing us what this journey can look like on a global stage. And you have been a trailblazer, right from physician, clinician to global architect, a woman leading the future of diabetes care. So, everyone, welcome to the Hexalot with Dr. Niti Pall. Quickly, few words about ma'am. She's a visionary clinician who spent over 3 decades not just practicing medicine, but reimagining how healthcare can actually reach masses, millions. From helping build the largest chain of primary care clinics in the UK to shaping innovative health models across India, Bangladesh, China, Middle East, and Europe, the list goes on. Her work sits at the powerful intersection of medicine, policy, and entrepreneurship. She's led global healthcare innovation with organizations like Bupa, HCL, Healthcare, and now KPMG's Global Health Practice as the recent most, where she drives work around universal health coverage across Asia. What makes her journey truly inspiring is that she represents something that we all deeply believe in at Y and, of course, across as well. That doctors are not merely healers, but architects of the systems that can actually transform societies. Please join me in welcoming the trailblazer, clinician, innovator, and global health leader, Dr. Niti. With that, may I pass on the baton to Dr. Lotika for the first segment.
Yes. So I start with the first segment. This is about the journey from a clinician to a global health leader. Traditionally, getting trained as a clinician, one moves up the ladder in a certain designated path. You have driven your way completely in a different way, breaking boundaries in medicine and leadership. This segment explores your journey and how you move from a clinician to a global healthcare influencer. So, you began your career as a physician, but today your work shapes healthcare systems across the countries. What inspired this transition from individual patient care to influencing global health policy?
probably a little bit of craziness, which you all have to have in driving change, I guess. For me, starting work as a physician, so I trained as an obstetrician gynecologist, by the way, in India, in PGI in Chandigarh.
Okay.
That's where I, was trained to did my post graduation. Then got married
Mhm.
and went off to the UK. I did do bits of obs and gynae, and then decided this really wasn't for me. And it was having to take some brave decisions like that, changing
Yeah.
career. You've got your post graduation. I was on the path to getting my MRCOG. I'd done my part one, but then I decided I went off to work with. I just wanted to do some community work, and I sat in with a physician in the UK in primary care, and I thought this was my calling. I've got to change. So I decided to retrain myself. In those days, you could do it,
Yeah.
and then went off to become a primary care physician. But again,
Oh.
I was started work in an inner city practice after the training finished. And in the UK, you can't become a primary care doctor without getting, postgraduate degree. It's just like you get a MD medicine. It's the same. So I went off to work in inner city Birmingham, where I had 33 different languages spoken in my practice. So we looked
Mhm.
after asylum seekers and the homeless. We looked after people after some wars that had happened at that time. We looked after quite a lot of alcoholics, and I had some great mentors. Uh, but when I saw, what impact you could make, it wasn't just sitting in my consulting room. Of course, it was very important, that consulting room, and being compassionate and careful with your patients. But I needed to understand why one woman would show up 13 times in 1 week to me. The UK, no one pays for healthcare, thankfully. So they could come 13 times a week to me. So just trying to understand why folks keep showing up, why the same families keep showing up, I started exploring communities. I started looking around me to see what it was. So we got a grant from the European Union to do something called Healthy Communities Collaborative. So we started to train volunteers from within our practices to actually take our services. We found in some minority communities in inner city Birmingham, their rates of, say, cervical screening or breast cancer screening were very low. And we tried to find out why that was. So we started training volunteers to take some of these things across. And that was the start of my journey, really, to understand how a health system responds, what you could do with communities. And that led me to then just, figuring out. A patient came to ask me one day for a walking stick. And in the UK, to get a walking stick, you need a doctor to sign it off because you get it for free. So
Yeah.
it was just understanding, but it was a complicated process. So just understanding how the medical stores worked. So I took myself off to a commissioning meeting to the UK NHS. And basically, I just learned on the job. So I always start the story with it was walking sticks that made me go into the UK commissioning fold. So then I did lots of jobs in the UK NHS on commissioning of healthcare for my local communities because that's what really interested me, really understanding how I could make that change at a community level. And then it became national. From national, it became international. And then at the age of 48, 50, I had two cancers. I nearly died. And I decided I was going to not wait for my retirement to do what I wanted to do next. I had set up one of the largest practice chains in the country. I handed it to my partners and I said, I'm off. I've set it all off for you and you can take. They all had a bit of a heart attack. And they were like, you can't be serious, really. But I was, and I went off to work with HCL in India to set up primary healthcare. And I was
Oh.
very poor for a while. I went from earning quite a lot of money to nothing uh, because it was entrepreneurship. I started my own business, biggest mistake of my life. But then HCL bought us out. I learned a lot. I became my own chief medical officer, my own chief operating officer. And then India just sort of kind of grounded me again to understand what the challenges were in primary care in India. And that led me to my next journey, which was understanding because if people don't know how to, if it's all out of pocket, which it is, a lot of care, you guys have
Yes.
experienced it. Uh,
Mhm.
then what does the health system look like? Got me to explore what payers have to do with this. So how do payment mechanisms work in different parts of the world, whether it's a government payer or, by the way, I'm not with KPMG anymore. I just wanted to make that clear. I consult on my own now, and I work across the world still, about 40 countries still across the world. But but that made me understand what universal healthcare systems look like. So we helped architect while I was with KPMG Ayushman Bharat in India, and we implemented it in 5 states too. So that was an interesting project, but many other countries. But I also wanted to understand how insurance could help, how private insurance can help. And I guess it has a bad rep in India. I'm not sure what you guys think of it, but I know the insurance penetration is really poor. So that got me to understand more about this journey as well. I wanted to understand how payment mechanisms work, which is currently where I stand, is on inclusive insurance. How do you pay for low-cost healthcare? And my biggest successes have been in Bangladesh, of all places. I could manage it in India, but in Bangladesh, we managed it. So I'll stop there, Latika, but it was really literally a journey of wanting to explore, wanting to understand more, to actually find out the reasons why, and to be curious about the ideas that took me on this journey.
Okay. So, having worked in multiple health systems, and what early experiences made you realize that healthcare transformation must happen at a systemic level?
Well, I think I answered some of that, but I
Yes,
think,
you
you
did.
can't in your consulting room, which is very impactful, which I'm sure all of you lovely ladies do really well. Women doctors make great doctors, by the way. You're far more empathetic and you make better doctors. But and I'll take you back to understanding some of this as well. And you know me, Lotika, as the president-elect of the International Diabetes Federation globally. That was heart and
Yes.
passion stuff as well. So we'll come back to that. My son
Yes.
had type 1 diabetes from the age of 4. He's now 25.
Okay.
So,
Okay.
we've lived with type 1 diabetes for many years. Also
Okay.
made me understand that actually, for advocacy worldwide, I needed to do something else. It wasn't going to be just making sure that Javier had the best possible care, but also everybody else got the best possible care. And you can only do that at system level. You can't do it in just a
True.
tiny little place in Birmingham.
That is so true. Now you are about to become the first woman to lead International Diabetes Federation in its history. What does this milestone mean to you personally?
Kind of hadn't thought about that, Latika, when I stood for election, actually, because I was standing on merit. And I didn't
Yeah,
actually
that's true, huh?
when I put up my application, and if you see what I put up there, it was professional expertise with personal passion was my strapline. It
That's
wasn't
true.
being a woman that was my
Yes,
strapline.
yeah, of
Yeah.
course. That is
But
true.
yeah, so I think it was, but I think when I stood up, when I did get elected, the first thing I said is, "You've got a woman president," in its first time in history. So,
Yes.
it was a milestone, because a lot of people who vote are men in this
Yes,
election. There are not
yes.
many women voting there, including from your
Yes.
country. Just remember, your representatives are all blokes. So they're good
True.
friends. I know them well, but there are not many women who break through
True.
that glass ceiling to reach that point that you say it's a difficult one. It's a very difficult one. And being
Yes,
a
yes.
brown woman, particularly in the UK, and reaching kind of where I did was another hard one. I have a lot of imposter syndrome. While I was with
Okay.
Diabetes UK, I was with them for 10 years. I served on many committees with them.
Okay.
And actually, I just walked into Mickey Hurst, who was then the chairman. I walked into his room and I said, "You've advertised for a trustee. I fit every bill. And I want you to consider me." He was so shocked, he didn't know what to say. It was like, I said, you wanted somebody from a minority community, you wanted somebody who's a carer or somebody with diabetes, you wanted someone with a health system. I've got all, so you've got to consider me. I think if I just applied blandly, he would have never given me the job. So
True.
I think it's also just about being brave and putting my head above the parapet that has got me to where I am.
Yeah, that is so true. Now I hand over to Dr. Rukaiya for the next segment.
Ma'am, one thing is you're definitely brave. So that is, something really nice. You know how you go up there and you don't wait for opportunities to come to you. You wait and you ask for them because you know that you deserve them all. So that's really wonderful. Ma'am, my segment is about how you re-engineered this healthcare system. An array of evidences that point towards the fact that a country is strong as its health revenue systems, And this segment is talking all about the policy, the prevention, and the sustainable care for all. And since you have a massive experience in across countries and also India that you have worked so closely, how does policies changed in us? So, ma'am, the chronic disease such as diabetes, which are now among the largest global health challenges, what structural changes do you believe health system must urgently adopt?
The big question. And there's not a short answer to that, Dr. Rukaya. And the what you must urgently, really address is
Yeah,
out of pocket. Your guys are, it's out of pocket. Your medicines are out of pocket. Insulin is expensive. GLP-1s only some people can afford. There's people who can't afford test strips. So forget CGMs and forget pumps. There's lots of people who just can't afford even basic needles and syringes. So out of pocket has got to stop. You've got to, if chronic disease management has got to happen, you have to have policies that allow you to fund it. If you don't have policies that allow you to fund chronic diseases, you will continue to see the rise. That's one. So universal healthcare is of imperative use. And it's not something that it's a nice to have in your country. It's an imperative. You have to have it because otherwise the WHO can talk all it's like about saying, insulin is on an essential list of medicines. If your
right,
government PHC doesn't have it, if your
right,
guys have to, walk for hours to get to somewhere to go and get, a proper standard insulin, well, who's going to use it properly, right? So you're going to see all of this. So I think that's really important. Number two, I think people have to turn their face to prevention. It's the left shift. If that doesn't happen, and all we're doing is treating people that come through, walking through our doors, which is what happened with me when I was sitting in my consulting room. Same people showing up over and over again, same people with the same problems, families, generations of intergenerational issues that were arising. And we had to go out and do it differently. We had to actually train communities differently. And the first thing I did was the Healthy Communities Collaborative. But we also I had a lot of women walking in with domestic violence issues, actually, particularly from communities from Southeast Asia, related to alcohol use, actually. And what we ended up doing was giving these women there's no point teaching them healthy eating and how to do stuff like that. We had to give them something at the end of it. So we worked with our local tech college to give them a training diploma in catering. I taught them to cook healthy, but also do other stuff. So I think it's about putting prevention in place urgently, but also giving people the tools to be able to do prevention in a community setting, because you guys can't do it. It's folks within communities that'll do it.
So it's about empowering the right community to the right talent so that they are able to take care of themselves and other people around them. So, ma'am, as government, so what practical steps you think our government can actually move from these policy promises, like yes, insulin should be mandated to all patients, it's an essential drug and should be available. But however, that is not how it is actually there in the real scenario. So do you think there are any practical steps where we as clinicians can, somewhere come in to help with this real patient access?
So I think there's lots of ways that you as clinicians can help. I guess your government took a very big step, huh? Ayushman Bharat was a big step. You
Yeah.
can see this reform from outer space. It's so big. Okay. So kudos to the government for having done this. It's a very, very difficult thing to do. UHC policy is very hard to do, and they got a lot of flack for it. A lot of clinicians like yourselves were saying, not enough money, you're not paying us enough, no one pays on time. You're a big country. It's huge numbers of people, and health in India is a state subject. It's not a central government subject. So the government can mandate a lot of stuff, but it has to be delivered in your state. And every state is massive. You've got, UP is the size of France, Belgium, and Germany put together. So, you've got a big states that have lots of populations. My view is that if the government is serious on delivering some of these promises, you can't just be funding secondary care. You can't just be saying Ayushman Bharat only covers secondary care. You have to fund primary care. if you don't fund primary care, you don't put that in place properly, and primary care in all its features. Primary care doesn't mean just prevention, right? It means treating, it means dispensing of medication. You have to fund that properly. It has to be government-led. Entrepreneurs in your country are solving some of these issues. I work with quite a lot of them. There's a company called iCure I work with in Orissa. There's another one I work with, Medoplus in UP. So I work with quite a lot of entrepreneurs worldwide on trying to solve some of these problems. But a lot of last mile delivery is bloody hard. Sorry, pardon my French. It's really hard to solve these last mile problems. How many of you have been to a village in Orissa or in Bihar or UP? I have. I've been on a bullock cart for 2 days getting to some of these places. Well done for you, Dr. Ritu. But these are the places where you need primary health care. If you're going to have to walk 2 days or get on a bullock cart for 2 days to access your health care in a hospital in Bhubaneswar, no one's going to go. So you really do need that last mile delivery sorting. You need your essential medicines there. And I have to say that in Delhi, they've made a start with that. So Mohalla clinics were a good start. Don't know why they've imploded, but they were a very good start to actually funding primary healthcare. So I've written a case study on that. Happy to share it with you guys. So it's things like that. And in Bangladesh, it's been through the pharmacy front end that we are starting to see this. You need to train other people to do primary care, not just doctors. You don't have enough.
Right. So, ma'am, as during your time as chair of the IDF region, what lessons did you learn about collaboration across countries with different healthcare systems? So, something that you learn from this country and you're like, okay, this is a good fit for India, or this is the right thing for Bangladesh. I'm sure you have this vast experiences.
Yeah, that's another. We'll have a chat about that over a cup of coffee one day. But yeah, when I see you in person. Yeah, lots of lessons to be learned. My ex-boss in KPMG wrote this great book many years ago. It was called In Search of the Perfect Healthcare System. Do read it if you haven't read it. Mark wrote this amazing book. It's a coffee table book, 2 pages on each healthcare system. And it's a tongue-in-cheek title. There is no perfect healthcare system. There's something to learn and something to teach from every healthcare system that I've been in. So for me, it's the humility to learn that and the humility to actually transfer some of that learning. So, for example, the innovation of India and the entrepreneurship of India is something that is solving your healthcare problems. It's not the government. You're solving it. So, it's the good quality doctors, nurses that you have in your country that are solving this. In Finland, it was the public health system. They've reversed their type 2 trend long before GLP-1s came along. And they did that by really good public health interventions, as did Estonia. Estonia funded really good quality data, and all their decisions are evidence-based and data-driven. So there's lots to learn from lots of countries. In Bangladesh, it was my journey with micro-entrepreneurship, micro-insurance, micro-lending with Grameen. So really starting to understand that. So I think there's so much to learn from everywhere. India is such a vast country. Every state is different. Every state is a country. So you can't say that, the Northeast, Assam is the same as Maharashtra. It'll be completely different. The challenges will be different. And I guess there's lots to learn from each other as well. So I guess, I'm still learning at my grand old age, and I hope to carry on learning till the day I die.
Ma'am, if you could redesign one element of healthcare delivery globally, whether it is prevention, financing, or workforce strategy, where would you begin?
Again, a difficult one to answer, but I guess financing is probably the most important one. How you finance health systems, what you do with them, and every country is different. Currently, I've got a project running in Namibia and Ethiopia and Nigeria and Sub-Saharan Africa, where tax revenue is very low. It's quite low in your country too. But, so is this going to be taxed finance systems? Are we going to look at financing bonds? Are we going to look at insurance? What are we going to look at to allow these health systems to be financed? Nothing works if there's no money. There's a huge hospital I came across in Ethiopia. It's a massive 8-floor oncology hospital, empty shell. There's nothing in there. They've run out of money to put the equipment in. That's what happened.
Right. Money does solve a lot of problems, that's for sure.
Only if deployed properly.
Absolutely.
And thought about properly.
Thank you so much, Dr. Niti, and over to you, Dr. Pranjali, for the second.
Thank you so much, Rukia. Um, Thank you so much, and good afternoon, ma'am. So after this lovely interactions, now I'll be moving to next segment, which is about technology and diabetes care. So Dr. Niti, we are living in a time where technology is changing almost every aspect of our life, and healthcare is no exception. So with AI, digital health tools, and remote monitoring becoming more common, so how do you see these innovations shaping diabetes care in coming decade?
I think it's probably the most significant innovation that's happened. And for me, as a mother of a son with type 1 diabetes, there's ATTT happening at the moment in Barcelona. I'm with you guys, but the rest of the world is out there on the diabetes technologies in Barcelona, including my son, who's there, who works for a type 1 diabetes fund, actually. And he's out there with his peers, really looking at the cutting edge diabetes technologies that will change their lives. For me, the advent of the closed loop and for Javier changed the way we view his diabetes. It's completely changed. When we started when he was 4, it was twice daily injections, finger
Yes.
prick at the age of 4, about 6, 7 times a day, waking him up in the middle of the night, making sure he's not got a hypo. Then you got the twice daily, you got the 4 daily, you got the long acting insulins. Then came along CGMs, and then came along the pump, and they weren't connected. So then the do-it-yourself community rose. You've got a closed loop system happening because the DIY community happened to make it happen. So me, Pranjali, it wasn't doctors, it wasn't pharma companies who drove that change. It was patients. It was people with diabetes who were driving that change. The DIY community was completely driven by people with diabetes, DDoc voices, all the advocates that I come across, they are driving diabetes technologies to the last mile. My sugar was put together by Kyle Jackrose, friend of mine. He's type 1 diabetic. So, because he was cycling across the continent and he wanted to make sure that his diabetes was under good control. So I think people with diabetes who are driving the technology change, it's not doctors and nurses, and it's not, they've been drag kicking and screaming into this front. We're rather conservative animals, us doctors, but it's the patients who've been driving this. So I think the interface of a consumer-led change alongside of what's happening on technology itself is what is driving that change and will make a huge difference the way people self-care and manage. I know lots of diabetes folks who try to have diabetes holidays. It's intense, huh? All day, every day, you're having to make so many decisions every day.
Yes, yes, exactly, ma'am. But ma'am, when we know that this is helping our patients to take decisions and take care of their blood sugar values, but especially if we see in India, we can't give these opportunities to all and each and every patient because there is a lot of gap between the fundings and financial stabilities and all. So how do we make sure that digital health in diabetes remains inclusive and it benefits everyone?
So
So
it really depends what you mean by digital health as well, Pranjali. So
yes,
there's
yes,
there's lots of layers to this, okay? So
yeah,
it's not about giving somebody the latest AI technology or a closed loop pump. It's about empowering people with evidence-based decision making, right? And that could be a whole host of other stuff, or access to telemedicine with their doctors, which you can do in India, you can't do it everywhere else,
yeah,
or access to a bot that allows you to make some of those decisions. Those are not expensive things, okay?
yes,
The
yes,
government also has to turn its face to that. And I think your government is starting. You had a big AI summit in India recently, yeah? And lots
yes,
of folks showed up there as well. So that's one side of it that democratizes healthcare, as far as I can see. The second bit, obviously, is by training folks to actually deliver that care better. And that uses digital technologies too. So for me, it's about not training you guys. You're already trained. It's about training the community health workers. It's
community.
about yeah, it's about training folks with diabetes to make those. Peer-led education is something that I did hundreds of years ago, and I was told by the GMC, I was actually dumbing down healthcare. It wasn't true, actually. Peer-led education is probably the most important thing to spread the cause. So there's lots of companies that are starting to do this and starting to look at that. That will democratize healthcare. The advent of the smartphone really has democratized healthcare. The advent of free data has democratized healthcare. So it's not just about what you do on technologies. It's about the backbone of it that democratizes your healthcare access.
Yes, exactly, ma'am. So nowadays, because of the technologies and smartphones, we can reach to the rural areas and we can actually connect with the patients, and counsel them also. So, ma'am,
Correct.
from your global experience and perspective, what is one innovation in diabetes care today that truly excites you? Like something that you believe could significantly change outcomes for people living with diabetes?
I think it's the patient involvement in their care. That's what excites me the most. And you guys really need to put your brains behind that. You don't have many patient advocacy groups, by the way, in India. You really do need to put your mind behind it because they are the ones who create some of these things. DIY was created by a patient group. Okay, so for me, what really excites me is the AI algorithms that allow you to make decisions early, not just on individual data, but on group data, population health data, and really starting to push that, democratizing access to data. That's the other thing that allows people to make good decisions. Like your community health workers. So I'm working with this company called iCure, and we've looked at data-driven decisions for chronic disease management for diabetes care, and they've managed. This is in rural Bihar, Orissa. It's not like in your cities. And so those data-driven decisions are starting to make a huge change to diabetes care. And I think for me, that's probably the most important one. Of course, we'll see something completely new that you and I can't predict. You've got type 1 diabetes prevention happening currently. You've got monoclonals for that.
Yeah.
Whether that's going to be, it's $100,000 a pop, so I don't think it's going to be affordable for the future for the moment.
Yeah.
But there will be things like that coming, particularly in the type 1 world. Be new devices and technologies. A lot of them are coming out of Korea, actually, South Korea. You're starting to see technology, medtech devices that are, a hundredth the price of what we're seeing. I'm seeing CGMs being printed. They'll be $5 a pop soon, $2 if you drive prices right down. So there will be things like that that will be driving down the cost of monitoring of care, and that will not come from the West, it'll come from the East.
Amazing, ma'am. Thank you so much for your answers. And over to you, Dr. Ritu, for your next segment.
Thank you so much, Pranjali. And ma'am, it's truly inspiring when you talk about the vast experiences. I'm sure we are hoping to see the coffee table talks soon, either in our country or that side. And trust me, the most pride that I can talk about right now is that you've been in this country and you talk so highly about it. So it's superb to have that connect with you. And now I'm going to also again bring you back to India where we recently had the privilege of meeting you at the Diabetes India at Hyderabad, and your sari, which you adorned with that traditional Maharashtrian brooch. I was also talking to Lotika about that. This beautifully actually is a metaphor and beautifully reflects your journey, which is you're deeply rooted into culture, but yet shaped by experiences across the continents, as you shared earlier. And this perfectly captures how global you truly are. So, in this segment, we're going to explore the global vision that you hold. So, my first question, ma'am, is when we talk about the president elect of International Diabetes Federation, what are your priorities that you wish to champion during your leadership?
I think the world is becoming a difficult place right now. We are in the middle of wars everywhere. So for one of the things that I would love to do is to make sure that supplies of medicines, essential medicines and diabetes is maintained worldwide in areas of conflict, in areas of disaster. We're going to see much more of that. So just making sure that that still remains and that we serve everybody, not just a few. So that's a big part of what my ethos will be about. Number two, on the funding of healthcare. So just making sure that we are at the table when those conversations are happening. And for that, you need a proper advocacy effort. So in the Middle East, for example, the MENA region have put together a plan for national diabetes plans in every country, and that they will measure people based on that. So people are not measured. They don't actually do. Governments will not do what they're supposed to do. So really second is the advocacy effort, making sure that you all have the toolkit to go to your government to say, this is not happening here and this is the evidence why. So what you're going to do about it. And the biggest advocates for that, that's my third bit, the biggest advocates, the biggest champions for that are your patients, are people with diabetes. If you don't have them, go with you. The way we changed stuff in the UK with Diabetes UK was by using, so the chair of our research committee, by the way, in the UK
Mm-hmm.
was a
Mm-hmm.
patient. So it's
Wow.
actually, even the research committee is chaired by a patient. So you really do then get the research that you want to see. So for me, it's making sure that we have the patient voice, the community voice at the heart of whatever we do. Every fundraising effort, every research effort, every effort that we make should have a patient at the center of it.
Beautiful the way you say that, it comes a full circle, because ultimately it is the end result is for the patient. So unless we truly realize what that person needs and we're able to have that voice at these different forums, it's actually not going to help. So I like the way you've been saying, put your brains behind the patient, put your brains behind the patient. And therefore again, the out of pocket really matters a lot, because unless you may have the patient being able to access whatever is economically available, there's no point in having the best technology
No,
in the world. Yeah,
exactly.
absolutely. Wonderfully said that. So I move on to the next question. And again, typically, like I said, that we really love the aspirations which you show and the way you speak. And I will also refer to, the earlier segment when you said that when you went up and spoke to, certain people and you made your mark. I think it is all about the same. Women are embodiment of empathy. Women are really there with, a lot of plans and are able to organize things with the, but the only thing is probably not speak up. So it's great for our audience to have a international figure here talk about how things can change if you're able to make speech, And I think now my question is that with over 500 million people plus, globally living with diabetes, where should your efforts be in terms of, singular countries? I'm saying whether it should be the prevention, early detection, or access to treatment. Of course, it could be different in different countries, but as from Indian perspective and from international angle, what do you think India should be looking into?
Well, I think you can't afford not to do prevention, okay? Otherwise, you'll have
Yeah,
such
of
a, you've
course. Yeah.
already got a tsunami, huh?
Yeah.
And you don't do the prevention bit of it, you're going to be stuck. Amount of, folks that you put behind it is actually going to solve this problem. Healthcare costs are rising. The total cost of healthcare is rising. The total amount of people, accessing healthcare is rising. So you've got no choice. That left shift towards, so there's three L's, the left shift towards community care, left shift towards prevention, and really democratizing access to financing is going to be really important for you guys. I think that's kind of, for me, for India, that's going to be an important one. Every state is going to have to put their mind to it. You guys are going to have to go out with this advocacy effort with the evidence to show your state what's there, what's not there. And every state will have a different angle on this. But you're really
Mhm.
going to have to make that effort yourself. In the end, you will not survive as just out of pocket. It'll be a fragmented American system. And you can see in the Commonwealth Fund report, they come out last. They come out 32nd in terms of health outcomes. You can't have that. It's
Right.
one of the richest countries in the world, and their
Right.
health outcomes are so poor, particularly for disease management. There's nearly 30 million people that are uninsured, don't have any health care in the US. You can't afford to have the same system, and you're also starting to get there. So it's watch out. So for me, India, you're on that path of a fragmented healthcare system and you can't afford it.
Definitely, yes, I can get those bits from you that, like you said earlier, that if we have these tools ready, which are your vision board for the 2026 and onwards, I think that will help few of us to have, that board ready and help probably implement having more advocacy groups, talking more to patients. And like you said, yes, correctly, that the DIY also came up from patients. So
Yeah.
maybe have more and more patients getting onto these kind of policy decisions and, move to the government to ensure that these
And
things happen.
politicians listen more to them than they listen to you because
Yeah,
they vote for them.
absolutely. Totally agree, ma'am, there as well. So my last question would be that what legacy would you like to leave behind at IDF for patients, for clinicians, as well as for those who are leading healthcare systems?
Some of them are very mundane, I'm afraid, Ritu, and the mundane is important, I think. IDF has been through times of great turmoil and change. So for me, it's leaving it stable. It's making sure it has enough money to function as an organization, as a global organization that includes everybody, good governance and transparent governance that allows for people to see where decisions were being made, how the decisions were being made, all the accounts being out in the open, making sure that
Transparency.
governance is completely okay. It's always as good as how it's implemented, right? So good governance is something that is really important. So I want to leave that legacy. And number three, I want to leave a legacy that includes patients, people with diabetes, at the heart of all decision making that we make at IDF.
Wonderful. I think, ma'am, you are a beautiful lady, a very strong one at that, and love the way resilience comes out in your voice, and so does assertive power, so does the inspirational motive as well. And I definitely would say that you are a great woman to lead the IDF, and I'm sure your leadership will inspire women physicians as well as global health leaders. With that, thank you, and I move on to Kavita for the next segment.
Well, thank you, Dr. Ritu. Good afternoon, ma'am. It's been inspiring hearing from you, hearing your stories, and learning from it. Our next segment is personal reflections, leadership, resilience, and lessons. Leadership often comes with a cost, responsibility, difficult choices, and many unseen struggles. In this segment, we'd love to explore your personal reflections on resilience and the lessons your journey has taught us. So, ma'am, leadership at a global level involves complex decisions and responsibilities. How do you stay grounded while navigating such influence?
So I have an informal counseling service, which are my friends. So it's really important to have a good circle of friends. And women generally tend to have more of a circle of friends and their sisters around me. So I'm an old lady. I'm 66 this year, and I have had friends for over decades and decades and decades. And they remain your counseling service. I can remember this really funny conversation I was having once, Kavita, with a friend of mine. She's a housewife. She's been my strength and resilience for me throughout my working life. She's helped me pick up my kids from school. She's not a doctor, but she would make sure that Javier was fed and watered and had his injection on time. So I can remember really fed up, and I rang Simi one day and I said to her, I'm really fed up and I've got a headache. She said, why don't you go and get yourself 2 paracetamol and a drink? And I'm listening to this woman thinking, I'm the doctor, not you. But she's giving me doctor type advice as well.
Wow.
So it's my friends that keep me grounded. My lovely husband, who is long suffering and lets me off and away to all these wonderful countries that I'm in. He's doctor himself. He's completely been supportive, and the family really. Javier has been my inspiration for diabetes. I can't let myself fall apart. I can't let myself have a bad day on advocacy, because I know at the end of that, there's Javier. He's had diabetes for so long, and he's such a good boy. I can remember, he's also got celiac, by the way. And I can remember when he was little, about 7, 8, when he was first diagnosed with celiac as well. And I was giving him all these instructions about, you can eat this, you can't eat this, you can't eat this, and you go into a birthday party, don't do this. And Javier went to me, Mom, why are you telling me all this? Can you tell me what I can eat? Stop telling me what I can't eat. Huge lesson to me in terms of positivity and relay and how you actually view your life. So that. And I also chair the board of an arts organization here in Birmingham, a South Asian arts organization. So like you guys, I love music, singing, dancing. I'm a trained Kathak dancer. I can't really do very much of that anymore. But I used to teach my patients Bollywood dancing. And that was better than giving them antidepressants. I did that for 10 years. And now, so chairing the board of this arts organization completely takes me to a different place. I go and listen to some music. I'll go and listen to some dance, help organize some. We did one called Sari Stories. As you can see, my love of saris was we curated a whole collection of sari stories this year in Birmingham, and we had an exhibition around that. So it's things like that that keep me grounded, and it's very important. And I'm a gardener. I garden a lot. My exercise is gardening, not hiking anymore. So I have a big garden, and I do the garden myself. I have somebody come and do the heavy stuff, and then I do all the planting and all that. So the gardening season has now started, and it's very hard to prize me away from my house when I'm actually in gardening season.
So that's so amazing, ma'am. Your own journey inspires work and focus towards so many other areas in your life. I mean, it's amazing. So, looking back at your journey, was there a mentor or moment that helped you see medicine beyond the clinical walls?
It did. So I had a partner at work his name was Dr. Kevin Vaughan. He's still here. He's still alive, thankfully. Kevin was my mentor when I went into this practice. He was my support. He retired as the president of the Christian Medical Foundation as well. So a very deeply spiritual man, a praying man. He used to pray with me every morning, actually. Not that I'm religious in any way, just spiritual. So Kevin was my mentor, and Kevin taught me how to be a better doctor. So he would do things like somebody detoxing from alcohol. He would go and sit the whole night with that patient, just making sure the patient detoxed well. He didn't have to, but he would do that. He taught me how to be a more compassionate doctor, a better doctor. And he also taught me that sticking your head above the parapet when all around you is falling apart is really important. So speaking out when everybody else was saying something completely different, but you believe this was the right thing to do, was the right thing to do. So he taught me that and taught me the strength to be able to do that. So that was Kevin. And then I had a really good mentor and another doctor called Dr. David Child, and I'll never forget him. And David, again, in a practice very close to mine, taught me how to figure out the British on committees, how to run a committee, how to do governance, how to listen to the unheard, how to actually get decisions through, things that nobody teaches you in medical school. David taught me. I just learned sitting by his side, learning how to do this. Sometimes people say stuff, they don't mean it. And the Brits are great at doing that. So it's been a learning exercise that I had to learn how to be British, how to be English, how to learn to be different. And he taught me how to do that.
Wow. This is new. I would love to learn that from you someday, or a cup of coffee, please.
Or something stronger, maybe, for that.
So, what has been the most unexpected lesson from working across different healthcare systems and cultures?
Say that again.
So, what has been the most unexpected lesson from working across different healthcare systems and cultures?
Yeah, unexpected. You find some golden nuggets where you go, right? So, this was the most unexpected was when somebody pulls you up, when your patients pull you up. And learning from your patients is probably the most important thing. So I have been pulled up over my beliefs and thoughts by patients, but you just got to put your pen down and start again. So that was one. So the individual patient interaction when patients teach you something is really important. It's just, I had this one patient who was trying to get onto insulin for months and months and months. And she walked into my room and she says, "Can you just stop pestering me now? My husband beats me every night. I really can't think about it. I've got to keep my head above the water. Just give me my medication and stop pestering me to take insulin because I can't. I just can't handle it right now." 12 years later, she came into the practice and she said, "Now I'm ready to start insulin, doctor. Now you can start it. Now I've got myself together." So all I could do was to support her then. So that's the unexpected, but you've got to remember, you've got to listen. You've got to keep the door open. You've got to make sure that you allow people to walk in through that open door again. So that was one lesson. And the unexpected I learned in Bangladesh from Professor Yunus and from micro-lending and microinsurance, how to use some of that better to create new health systems. So we've got nearly 17 million people using that product now. And it was very unexpected. I didn't expect that it could scale so quickly and so fast. It was the start of my inclusive insurance journey. Unexpected how some of these micro entrepreneurs, micro lenders, micro banks were using their community power to actually finance systems that could prove resilient for the future.
Amazing. One last question for you. What advice would you give young women physicians who aspire to influence global health and policy?
Just go do it. Don't wait.
Just like
Don't
Nike
wait for
says,
people to
just do
tell you
it.
you're good enough. Don't wait for people to tell you you need to do this. Just go do it. And there's nothing more important. In my KPMG days, and lots of my clients stayed with me afterwards, was the fact that I've actually done some of the stuff. It's not like I was reading out of a textbook or using ChatGPT. When somebody asked me how to create a quality dashboard, for example, I've done it. I went by 5 different countries. I can tell people how I did it in those countries. Just go do it. Just go do what you need to do.
Yeah. Thank you so much, ma'am. Moving on to the next segment with Dr. Rukia.
Ma'am, it's been wonderful hearing you. And this is the last segment for today, which we call as the rapid fire segment, the pulse of life, where we switch the gears, we lighten it up, and with our signature white pulse. So I'll be asking you a few quick questions, and I want answers which are very quick, instinctive, and honest.
Sure,
So
one sec. I've got another call that I was trying to just postpone. Hold on.
Yeah.
I thought we'd be finished. I'll go back to back. Never mind. Yeah, go ahead.
Okay. So, ma'am, the first question is one word for global health and one for women in global health.
Resilience.
And word for global health would be also resilience. Same?
No. Fragmented.
Okay. What's more complicated? Global healthcare policy or family WhatsApp?
Both. I'll give you an answer to that. Family, actually, important.
Which ones are the toughest to negotiate? Policymakers at work or children at home?
Definitely policymakers at work.
Your child has been really nice. Coffee with a global leader, who would it be and why?
Interesting. Global leader. I would like coffee, but not 5 minutes. I would like more than that with your prime minister.
Oh, interesting. And why?
He's got the ability. Mr. Modi has the power of convening your healthcare system currently. He's got people behind him. I just like to be able to talk to him about that. I'm sure he's got tons of advisors, but I'd love to hear what's next for Ayushman Bharat.
Okay, fantastic. Ma'am, Bollywood versus Hollywood. What's Dr. Niti Paul's preference?
Bollywood, of course.
I thought, he's been Hollywood dance for 10 years. I'm like, you can't remove that from anyone who's been in India.
No, absolutely not. It's Bollywood for sure.
What is it that wakes up Dr. Niti Paul excited and motivated every Monday morning?
What motivates me? The fact that I'm going to see my grandson on a Friday and look after him.
Fantastic. Really wonderful. If you could redesign one thing in global healthcare overnight, what would it be?
Make every government be accountable for the spend they make on healthcare.
Okay. It would not be insurance. You
No.
think insurance solves a problem?
No, it's both. I mean, health financing can be all sorts of things. It could be insurance, it could be government funded. There are lots of systems in the world. And it's just making sure they spend enough money on healthcare.
Right.
You spend about 2% of your GDP on healthcare. Sri Lanka spends 7%.
Lastly, your aspiration as president-elect put in one word.
Get patients at the heart of decision making. Patients first, patient first, patient first.
Absolutely. I think that is one thing that we've got through all through in this hour of talk that we had. And this was completely sharp, very sincere, and so authentic, just as what VIBE stands for. It's been so wonderful talking to you. And over to you, Dr. Lotika.
Dr. Niti, it's really been so lovely. We've had so many learnings and take-home messages. For me, of course, what was very important is to have a good circle of friends because they really keep you grounded, and that was nice. Dr. Ritu, what about you?
I'm just going to put out a statement there that vibe is something that I would like to make Dr. Niti our brand ambassador, because when we say vibe, it's women inspire, build, and enhance. And I think, I had that figure that somebody has to be that. And I think it is you, Dr. Niti. Thank you so much for inspiring us. We'll always keep coming back to you for more and more.
Yeah. So, next, Dr. Kavita.
Yeah, ma'am, you've been like a vibe icon, literally. Like you literally stand for vibe, the full form of vibe. Women inspire, build, enhance, like what Dr. Ritu said. But I love what you said about data-driven change and DIY communities. I'm going to focus on that through our hospital. Thank you very much for sharing.
Dr. Pranjali.
Yeah, so ma'am, you were just amazing, and there are many things to learn from you. But most important thing which I understood and what I got it is being brave, opening up yourself, talking, taking action, action, action is the thing which you need to do in your life. So taking action is the key in your life. Rukia.
Yes. So Dr. Niti said, just go and do it. Don't wait for people who are going to come and give it to you or offer it to you. If you think you can, just get up and go and do it. Getting above that parapet and asking for things which you think you deserve it is absolutely the thing I think is my learning from Dr. Niti's talk today. And yes, the friend circle, and this is what Vibe is, the community that we are trying to create over here, where each one, supports each other, helps each other, and is non-judgmental to each other. So yeah, thank
Thank
you,
you
Dr.
so
Thank you,
thank you
guys.
so
It's been amazing being with you. I learned a lot from you guys as well. Hope to see you in person one day over coffee or
so
something stronger, Latika, when I'm next in
yes,
Mumbai.
definitely,
The
definitely.
humility,
So
ma'am. Love the humility.
yeah, we like to end with our signature. If you can, W, we say be the vibe. So at the count of three, we say be the vibe. So 3, 2, 1, 3.
Be the
So be the
Be the
vibe.
vibe.
Thank
Thank
you
you
so
so
much.
much.